So I'm very happy to welcome the moderator of today's session, Stefan Gellmann from the Fondation Bodnar, the Bodnar Foundation. So Stefan is a great supporter of AI for Good, and the Bodnar Foundation is also very supportive towards the work that ITU is doing together with the World Health Organization on actually building an assessment platform to test the quality of AI solutions. So Stefan is the CEO of the Bodnar Foundation, and he's going to manage today's session. So you will be just sitting there. You stay sitting there, Stefan. Yeah, okay. With our panel, so some colleagues will be live here, like in person in Geneva, and some colleagues last minute, literally speaking, will join us remotely. Okay, Stefan, thank you.
Thank you very much, and it's really great to be here this afternoon here in Geneva, but for all the audiences that are online, and I've understood we have more than 400 people who are actually joining us online. So really a big welcome. For those who don't know Fondation Bodnar, just very quickly, we're a Swiss-based foundation that focuses on the improvement of young people's well-being, specifically in urban spaces, but within a digital age. And so we're looking at how can we leverage AI and digital technologies, but ensure that this is done in an inclusive way and respecting human rights and dignity of all people involved in an equitable way. And we are sort of encouraging as well dialogue and conversations across all different sectors and partnerships. Now, this is one of the reasons why we are both supporting actually the ITU AI for Good platform since 2019. And interesting, actually, maybe just as one example of how important this platform is on AI for Good that the ITU is hosting, is just that in one of the first conferences that the ITU AI for Good had, the idea emerged in the health space of something like a CERN-like structure that actually now we have a representative here, Ambassador Amardeep Singh, who is the Executive Director of IDAR, which is the International AI for Health Research Collaborative, that actually is directly coming out of one of the ITU AI for Good sort of convenings. And so we see that, you know, these convenings, they actually are where new ideas are created and new collaborative solutions are starting to really make then later on an impact. We are as well a founding member and supporter of Transform Health Coalition, which not only organized today this event together with the convening partners and co-hosts, but as well actually is the one who launches for the first time the Digital Health Week, which is really an important sort of piece on the global calendar for now and for the future. Because there is a realization that unless we really accelerate digital technologies and invest significantly into them in an equitable way, that the achievement of UHC by 2030 just remains on paper and a pipe dream. So we are collectively really challenged, and it's a great pleasure that the civil society engagement mechanisms for UHC 2030, as well as Medicus Mundi Switzerland, are co-convener of this event together with the ITU and Transform Health. Today's event is extremely timely. I think, as we can see here, we all have masks on, except those who are speaking. Many couldn't even travel to be here with us. We are facing continuously a significant crisis. It's as well a crisis, not just on the pandemic level, but the pandemic is made much worse because we have failing health systems and lack of universal health coverage across the world. And it's failing as well because we are not investing significantly into the digital health solutions that really would get us across some of these issues much quicker. Even more so, we actually punish some countries. And I was just referring to a quote of a South African minister who just 2 days ago basically made an important quote that, you know, they have invested in science and technology. We're the worst one to sequence the new variant and then get punished by the international community for being transparent and at the cutting edge of science. These are challenges that we need to really overcome. And I think Transform Health Coalition, with all its partners focusing on campaigning and advocating for equitable solution and new investments into the digital space, is really critical. And so I would like you to join all who are online here in this really excellent panel. That's both a blended panel. We have some panelists here. It's great to have you here. And then as well, some of the panelists online. But now I would like us to kick off with Derek Munene. He's the unit head of the Digital Health Capacity Building and Collaboration team at the World Health Organization. As Dr. Sumia Sawaminata was unable to come because of pressing business at the World Health Organization. Over to you, Derek.
Thank you so much, Stefan, for those kind remarks, which are very timely indeed. Once again, conveying apologies to our chief scientist, Dr. Sumia Swaminathan, who would have been able to join this important session at which important discussions will be made, but has not been able to join due to other commitments. However, as an organization, we are committed to supporting the digital transformation of the health sector, and hence the delegation to come to this session virtually. I would have loved to be there in person, but I'm presently connecting remotely from Lusaka, Zambia, where I'm teleworking at the moment. So I'd like to say good morning, good afternoon, and good evening, depending on your location. And would like to thank the organizers, Transform Health, and the coalition for the kind invitation, and Stefan, for your kind remarks as well. Indeed, we are in a very complicated and difficult situation given the crisis we are in right now, which has underscored the need for a digitally enabled health system. If we are to fast track our progress towards UHC and other health-related SDGs in the age of COVID-19, we need to ensure that we're making appropriate investments that can both prepare, predict, and respond in a digital fashion to future pandemics, and thereby strengthening health systems, and also ensuring that we are putting people first, fast-tracking patient centricity, and making sure that we're improving health outcomes. So COVID-19 has taught us a lot in this particular path. And this particular session that we're having comes at a very opportune time. As a number of you might know, WHO recently got approval from the 194 member states around the implementation of the global strategy on digital health. A number of partners on this call have been part of that journey. Our member states gave us 4 key objectives to focus on in the journey towards digitally transforming the health sector and accelerating the path towards UHC. And these broad objectives really speak to those areas of investments that we all need to jointly focus on to ensure that health is appropriately positioned in the digital age. So really focusing on key areas around international collaboration and national collaboration around digitalization, and making sure that skills transfer is appropriately put in place for our member states to be able to consume, implement, and scale digital technologies. That's being the first objective. The second objective focuses on what our donors agreed upon in 2018, those principles of donor alignment that focus on using national strategies as an entry point towards digital transformation of the health sector. So the second objective is key in as far as focusing on implementation that is cohesive, not siloed, but integrated, really looking at what are those actions that nations have agreed upon as represented in the national e-health and digital health strategies. The third objective is quite key because it really focuses on governance. How do we ensure that the whole of government approach is sustained and the whole society approach is put in place? Putting in place governance mechanisms at all levels. It's critical for us to be able to instill a sense of ownership of digital implementations. That being the third objective, I'll briefly make remarks on our fourth objectives, which is really focused on patient centricity. In the past, health systems have been characterized by a provider-centered approach. And the third objectives puts people first and aims at accelerating universal health coverage, UHC, by ensuring that we leave no one behind and that we leave no one offline. Patient centricity is critical, and this ensures that we are putting people first and fast-tracking this patient-centeredness that we are all pursuing towards. Just wanted to also echo the commitment the organization has placed upon making sure that appropriate instruments exist to ensure that the journey of implementation is cohesive, constructive, collaborative, and also promises scale. We recently released a number of instruments, such as the Artificial Intelligence Ethics and Governance Guidance, that is intended to support member states in their pathways of harnessing artificial intelligence. In this fourth industrial revolution, we're seeing a surge of innovations and digital technologies. And these frontier technologies promise us to fast-track UHC and other health-related SDGs. And AI, artificial intelligence, is quite key in as far as mitigating the human resources gaps and also ensuring that we are reaching the people where they are, especially marginalized populations. We also released the Digital Investment and Implementation Guide that is intended to provide a methodology to our member states in as far as introducing, scaling, and at the same time evaluating digital health investments. And lastly, we recently deployed the Digital Health Platform Handbook that is intended to address issues around interoperability. These instruments are one but many instruments that exist out there. And so we urge this esteemed set of panelists and this esteemed audience to really focus on how do we use the learnings of the past decade to fast-track digitalization, making sure that we are building health systems that are not only reactive, but also responsive and predictive. Health systems that put people first and health systems that move us closer in our pathways towards universal health coverage. With these remarks, I would urge all participants and all discussants to really focus on putting people first, leaving no one behind, leaving no one offline, and fast-tracking universal health coverage and other health-related SDGs. With these remarks, I would like to thank you once again for providing us an opportunity to air these opening remarks. We'll pass the floor and the mic back to the moderator. I thank you.
Well, thank you very much, Derek. And I think we take clearly that message of people first and leaving no one behind. I do think that's at the core of as well Transform Health and universal health coverage, as we sort of will hear from people here on the panel. Thank you so much. I would like to move now to Nanjira Sambuli. She's the president and co-chair of Transform Health, currently based, I think you're in probably Nairobi at the moment, but never sure with you. And you're setting sort of the scene, the case for digital health, accelerating progress to achieve UHC. Go ahead.
Thank you, Stefan. Good afternoon, good morning, as applies, and good evening as applies to all. I believe there's a slide that will go up shortly. And with this, I'll be setting the scene for why Transform Health is involved in this and making the case for digital health as a means of accelerating progress to achieving UHC. Now, as you may know, we have just 8 years left to achieving the goal of UHC by 2030. Whilst most countries have expanded access to health services and coverage of key interventions over the last 2 decades, on current trends, many countries, particularly low and middle income countries, will not meet this goal. Half of the world's population are being deprived of essential healthcare. This is simply unacceptable. We need innovative approaches to get the world on track. The application of digital health is one of the ways that countries can move forwards in providing their populations with essential health services. Digital technologies, advanced analytics, and big data in healthcare open up new opportunities and possibilities for delivering and accessing essential health services, both for those connected to the digital ecosystem and for those who are currently not. In addition to transforming formal health systems and services, digital tools also offer novel ways for individuals to self-manage and promote their own health. Digital technologies and the data they generate, however, are not a panacea. But when used in the right ways, they can complement and enhance traditional health service delivery models to expand universal health coverage along its 3 dimensions. 1, through increasing availability and quality of existing health services and through the introduction of new digital health services, digital health can expand service coverage. Second, by reaching underserved communities through telemedicine and online services, digital health can expand population coverage. And third, by reducing overall health costs and helping individuals manage personal health financing through digital insurance and payment services, digital health can expand financial coverage. In addition to these three dimensions, digital technologies and data can support the achievement of universal health coverage by strengthening health governance. While there's much excitement and hype about the potential of digital technologies, this potential is not being fully unlocked towards achieving UHC. The positive benefits of digital technologies and data for health are not yet being made available to everyone. And the application of digital technologies without due consideration of key principles such as equity and human rights risks undermining efforts towards universal health coverage. Today, Transform Health is launching a new report that makes the case for digital health and how it can help us accelerate progress towards UHC. In our report, we show how digital technologies and digital health interventions can support UHC by mapping them against the different dimensions of universal health coverage. We have also begun to build up a collection of case studies to illustrate how low and middle income countries are already using digital tools to expand universal health coverage. Some are included in the report, and the full collection can be found on the Transform Health website. The opportunities for countries to leverage digital health interventions in support of their overarching health goals are clear, but there are several interrelated barriers that are preventing countries from fully harnessing digital technologies in support of UHC. In our report, we categorize these barriers into 4 groups: individual or community level barriers, national level barriers, transnational barriers, and ethical and human rights concerns. Issues like lack of connectivity, exclusion from decision-making processes, and low digital literacy have led to the exclusion of large groups of people from enjoying the benefits of digital health. This is contributing to existing inequities at national and local levels, making it harder for those who are traditionally left behind to access the health information and services they're entitled to. For digital health interventions to be effectively applied towards UHC, sufficient political will and investment is needed at national level to establish and maintain the foundations of digital health. This includes building the digital health infrastructure required to connect every health facility and eventually every household and individual to the internet, building a strong enterprise architecture, and increasing the digital literacy and skills of the health workforce and general public. Addressing the basic building blocks of digital health is critical to close the digital divide and ensure everyone benefits from the digital transformation of health systems. The global nature of the internet brings many positive opportunities for advancing UHC across countries. However, it also presents challenges for regulating and controlling the quality of digital health tools and online health information. Coordinated global approaches to governance of digital technologies and data are therefore needed to maximize the benefits of digital health for UHC. Ethical and human rights-based concerns arising from the application of digital technologies in health and collection and use of data for health risk undermining confidence in the benefits and opportunities technologies offer, thereby posing a threat to the achievement of UHC. These include collection and use of biased and unrepresentative data, violations of individual privacy, commercialization of data, and the environmental impact of digitalization. To ensure that everyone is able to benefit from the positive and transformative effects of digital health technologies and data, governments, with the support of partners, must now accelerate and expand equitable access to digitally enabled primary health care as part of broader efforts to achieve UHC. This must happen alongside action to strengthen governance frameworks to fairly distribute the benefits of innovation and mitigate the ethical and human rights concerns associated with digital technologies outlined before. Unleashing this potential will require coordinated, multi-sectoral action to close the digital divide and implement UHC-driven approaches to digital health. Later, Mathilde will go through our recommendations to policymakers and other digital health actors, which, if implemented, will enable us to achieve health for all. I hope you'll take the time to read our report and join us in pushing for action to accelerate progress towards UHC in the digital age. Thank you.
Thank you very much, Najira. I would like to pick one element that struck me. I mean, it was really important, the role of government, but I think the issue of the digital literacy on health worker, and I would like to expand that. There is really a serious issue of lack of digital literacy of senior policymaker. We really face that most policymaker and people above 40, and I include myself there, are basically in a very analog mindset. And we need to really have intergenerational policy making of bringing the young people who've grown up in this digital age and think digitally in all they do into the policy making. And Transform Health is really trying hard to campaign that young people are at the forefront of engagement in digital health policy making. Because it's those people not only who actually are the most user, it's those who actually understand what it means. And I was recently in Morocco, and I was quite blown away in the city of Agadir, how actually the sort of the city council, the sort of above 50 policymaker have started to take young people, sort of age 30, really at the center of the decision making on transforming, the digital ecosystem. They're a good example, and we just need to scale them up. But now let's get straight into some other countries where, specifically from Africa, we have Njida Ndili, the country director at Farm Access in Nigeria. I have seen her is online. And then we have as well Henry Manieka, the regional director for Africa for PAF, based in Tanzania. He managed to join us here live. And I would like to ask the two really from a country perspective, and in the case of Henry, from a regional perspective, what sort of progress do you see is being made currently? But what are you seeing as some of the key challenges related to digital transformation for UHC on the legislative, regulatory, policy space? Over to you, Njida.
Thank you so much, Stefan, and thanks to the organizers for having me. I also have to say that Farm Access, which is celebrating 20 years this year, is one of the founding members of Transform Health. So I'm happy to speak about some of the work that we are doing. Nigeria is, a representative of what you would call one of the countries that has a huge potential to either accelerate access to basic healthcare services using digital technology or fail in the process. We have all the characteristics. Nigeria is a country of over 200 million people. We are one of the fastest adopters of mobile technology with over 170 million active phone lines. But yet, less than 5% of the population has access to any kind of health insurance. So over 70% pay out of pocket for healthcare services. And having said that, this 70% living on less than $2 a day really doesn't have access to the basic healthcare services. So we have quite a number of pillars that need to be addressed if we are going to achieve universal health coverage by 2030. The first I will start with is that, in my work at Farm Access, which is an international NGO funded predominantly by the Dutch Ministry of Foreign Affairs as aid to trade to the Nigerian government, we're also in other African countries, is to build capacity of not just the regional government, but also the federal government towards building a sustainable healthcare system. So we look at the entire ecosystem. So you look at the demand side, we look at the supply side, and the demand side really is about healthcare financing. Supply side is about quality tools. Then we look at even the behavioral change of the population itself, and then capacity building and governance, which is really the role of the government. And underlying all of this is where we try to infuse technology. So the issue really is that quite a number of points have been touched on. The fact that out-of-pocket payment is still a problem. But to solve this problem, how do we even begin to understand where the people are? Visibility, being counted, and connectivity. That remains a really critical problem. How do we ensure that no one is left behind and everybody is connected? That really is a problem. So in some of the work that we do, we try to leverage mobile technology, which is easier to access. Almost every adult has a mobile phone. It may not be a smartphone, but at least it has the ability to transact. So we're using this technology to, on the demand side, for example, to aggregate funding. In Africa, in Nigeria, there's a lot of developmental funds, Global Fund, PEPFAR, Stop TB, you name it. There's so many vertical programs, and we are now implementing systems where we can aggregate the financing through the mobile phone, ring-fenced within a wallet that can direct you to accredited healthcare facilities. But something that was mentioned earlier is the fact that the regulators themselves or the enabling environment is not adequate. And that is where, as part of our work, we also try to push for capacity development of the regulators. So for example, we have the National Health Insurance Scheme, which is a regulator of the healthcare services and the insurance scheme in Nigeria. At some point, they developed insurance on the mobile phone, but the telcos wanted 60% of the premium as their fee. So you find that, in a situation where the regulators and are not in a position to legislate or govern or create an enabling environment for innovation to thrive, then we have a problem. So it's that delicate balance between regulation and innovation, and the regulators having the capacity to regulate such that innovators can thrive. So you have a situation where predominantly private sector is driving the agenda. So it's now about governance. How do we ensure that the governance is at the same, in fact, on the same page of the same book with the innovators, and they take their role in terms of determining, what the rules are, how we can use existing technologies to connect people, especially those at the bottom of the pyramid, because without it, we're not going to reach UHC as proposed. And also, how do we ensure that we don't stifle innovation? So it's a very delicate balance, but there's still some progress being made, as well as on the supply side, where, there's, some of you may have read the Lancet report, which states that in low and middle income countries, people are most likely to die of bad care as opposed to no care at all. So how do we even begin to regulate using digital technology? And some of that already exists, but it's pockets of excellence that need to be linked together in a governance structure such that we're able to understand what is going on. So there are quite a number of potential accelerators that need to be harnessed. Digital definitely is a very important leverage that we can use, especially mobile technology, for aggregating financing, for reducing transaction costs, for connecting people, identifying people who ordinarily will not be connected. But then again, there are other, what I would call, when you look at the Maslow's theory of connectivity, the enabling environment, whose role is it to create or invest in the enablers? The electricity, which is almost non-existent. The data, why is data in Africa more expensive than the rest of the world? How can we reduce the cost of data? The digital literacy, how do we ensure that people are educated enough to know the potential of digital technology? The governance structure, so that those who are deploying the systems are not mining the data to the detriment of those who are using the system. So this is where governance comes into play. And unfortunately, at the present time, we are still building the systems and the guidelines and the principles. And I'm happy that WHO mentioned that some of this is already being deployed, but how do we ensure that it's being used and implemented towards a better system that would enable everybody to be connected, privacy protected, equity and justice for those who cannot normally access healthcare system without digital technology. So I'll stop there for now, but I can.
Fantastic. I think you brought up some really critical issues. And I think what struck me is this notion of it, people die because of bad care, not because of no care. And how can we get digital really to look at the quality of care aspect? And I think the other thing that strokes me is this issue of the data, the cost of data across many countries. And I was just last week actually on a panel moderating a session of African leaders, health leaders, fellows of the Chatham House. And there were a number of Nigerian actually there. And the idea came up of why not, moving fuel subsidies into data subsidies, which might be more popular than removing fuel subsidies, which they've tried, and then they have riots. But if you probably move it into data subsidies, it's the young people who benefit, so they don't go in the street and demonstrate for free data packages. So these are policy choices. And I think, we need to think more creatively on these things. Henry, give us your regional and country examples related to some of the really good stories that are coming out of East Africa on the digital transformation, but as well, maybe some of the challenges you see.
Thank you. Thank you, everyone. Good morning, good afternoon, good evening. It's a pleasure to be here in person. And this is a very interesting conversation because we've seen countries making progress quite a lot when it comes to digital. If you look at digital health strategies in the past, they were very technical. But now we've seen countries moving away from technical digital health strategies. Now they are focusing on how do they improve client experience. And that is new. But also, we are seeing many countries involving stakeholders because collaboration is key if we want to achieve a universal health coverage vision using technology. So countries don't stop there. We've seen countries now, once they have their digital health strategy, they have to now strategize how do they implement those. So they're coming up with investment roadmaps that outlines what needs to be done, in which sequence. Again, also collaboration is key in that area. And we've seen now countries utilizing the power of private sector strategies like enterprise architecture. How do they make sure that when we build these systems, they can communicate with each other? And most importantly, our digital health investments complement the vision of the health sector. So those are the progress that have been made, and countries that have come up with their health sector strategic plans nowadays, they mention specifically the power of digital. I was talking to one of the ministers who mentioned there's no UHC without data or digital. And that really caught my attention because now high-level policymakers appreciate the power of technology and how they can utilize it to improve health. But also we've seen that, apart from emphasis at sector level, but also presidents in these countries now, they are pushing digital agenda, and not only from digital economy point of view, but to improve the health or the well-being of the population. So we are seeing a lot of progress. One of the challenges that we are seeing in many, many countries is how do we now utilize these digital transformation efforts to make sure that we have strong governance structures, we have policies, we have guidelines in place to make sure that they can really deliver the promise that they have. So we need to have legal frameworks. We need to have data protection acts. We need, Jide mentioned, we need to have strong governance structures, but also government should drive the agenda. The agenda should not be driven by others. If it's driven from outside, we cannot really realize the potential of digital. So apart from legal governance and also driving the agenda, which is strong leadership, we need to create awareness. We've just worked on, because we've seen AI as a new kid on the block, but we have to be careful how we introduce AI. Everyone is talking about it, but how do we make sure that countries get benefit? So one of the work that we are doing is we start by creating awareness, building capacity of the policymakers, making sure that they understand what it is, they understand what potential it brings, and how they can apply it. With that, they can be informed consumers in such a way that they'll be able to say, to provide a leadership and direction so that countries can benefit from that. So I'll stop there for now. Back to you.
Thank you very much. And I think we brought up the issue of really the ownership of countries. And I think it's about really inclusive ownership of national sort of strategies. And I'll get back to you later if you have a bit of time on the question of investment, domestic investment in terms of domestic financing. But I would like to go now to Javier Urgade Belloc. I hope I said that correct. Javier is the founder and editor of The Key Correspondent, and he's a member of the Civil Society Engagement Mechanism for UHC 2030, the advisory group. Over to you, Javier.
Thank you very much, and thank you for partnering with CSM on this key event. As part of civil society and communities, and as part of the UHC movement, the first thing that focus is on access to health. The reality before the pandemic was that most of the world population, access to health is a huge challenge, full of barriers, catastrophic costs, and mainly intersected by inequality. Interestingly, the digital age and tools have similar access challenges. Most people who need health services are not adequately connected, as has been mentioned by previous panelists. Most people who need health services that are not adequately connected, the connection getting to digital is more costly than those who have a better financial situation. Those people are communicating the least. We have seen with COVID-19 quarantines and lockdowns, a minority kept track on their health, physical and mental health, online with the doctors and therapists, informed themselves about what to do in the epidemic. Their children continued to receive virtual education, had fun in some way, and found ways to connect with their families. But this was a real minority. Most of the people that has been said in this panel have struggled on access to digital commodities, tools, but also access to health. Primary health services, including those provided by community-based organizations, need to be prioritized urgently to increase access to digital health, among other tools. As we access to health, access to digital tools, we cannot leave anyone behind. No access to health, neither access to digital tools. Perhaps the best way to illustrate my point is that in our countries, particularly developing countries, citizens have better quality of life, timely diagnosis, better treatment if they live in capital cities. Advancing e-health or digital health so far only reach a metropolitan middle-class subgroup of people. I mean, outside of a specific project of pilots, there is, even after almost 2 years of the pandemic, is still a commodity for a subgroup of elite population. At UHC Civil Society Engagement Mechanism, we work with more than 1,000 organizations around the world to narrow the gap in access to health, retention people in comprehensive health services. So we must ensure that digital health does not increase the access gap, but is designed to reach and benefit the most marginalized people and communities. That if they do not have formal education, they can understand their health situation. If there are people with disability, the technology is at the services of inclusion. If they are indigenous people, to offer culturally sensitive services, and the list could go on about how we can make sure that digital health, it's an enabler of better quality services for multiple populations. Finally, these days, if you go to a public hospital, the doctor might have 5 minutes for you. In a private insurance clinic, you might probably have 15 minutes with the doctor. So if that's time is spent typing and filing a form or a clinical file or chart online, we could risk to losing the eye contact between the professional and the patient. It might seem like a micro detail, but that will become a big challenge if we do not reach the balance between connecting with people, with persons with anxieties and that pay a lot of money to access to health with the professionals. And I understand practitioners, doctors and nurses that they must, in many countries, including developing countries, type the information into database, online charts, etc. We need better accountability from the private sector working on IA and providing digital access to commit on increased access to health, human rights, and many other things now. Probably I focus on some of the challenge. Our constituency of the Universal Health Coverage Partnership, CSM, embrace digital health, of course. It's a perfect example is that we recently launched the Health for All Advocacy Toolkit, a new resources to build the capacity, inspire, and mobilize civil society in support of the global movement of universal health coverage. CSM works to strengthen the collaboration and coordination among civil society organizations who work on different health and beyond health issues to come together around a common goal of health for all at global, regional, and country level. We created space for meaningful engagement between civil society and decision makers to ensure they are developing and implementing equitable, right-based, and human-centered universal health coverage policies, strategies, and approaches that prioritizes the most vulnerable population, these populations that other speakers mentioned that have been left behind. So we work, and we have been continuing working on UHC the last 2 years, of course, thanks to the virtual media, and we will continue like that probably some time ahead. But I think all the considerations needs to be taken care of, because the communities and people who are left behind will also be left behind by the digital world. I will stop there, and thank you very much.
Thank you very much, Javier. And I think you brought up this issue of time and how much actually time is used for like administrative paperwork or filling in even, electronic medical records, typing on laptops and that time is not available for engagement with actually people. But, there are new technologies, and I was impressed recently was meeting the Greg Moore, who is the vice president for Microsoft Global Health. They're working on ambient intelligence, where basically at the back end of a medical conversations, all the records are, being typed up and summarized, and you don't need to do that anymore. But the point here is, if you gain then more time that digital brings, it's then a political and a policy choice, whether that more time is then as well actually spent with patients, or just the time is squeezed to have to see more patients. So, we really need to see that the digital, whilst it's critical, it's not a silver bullet that addresses all the other underlying issues. So we need to see, this from a holistic perspective and ensure that digital really delivers better quality at the end of the day. So let's go to Lucy Fagan. She's a public health doctor and a youth advocate with young experts tech for health. Over to you, Lucy.
Great, thanks so much, Stefan. And I'm really pleased to be joining all of you virtually. So I think I wanted to share sort of two very key things about digital transformation of health systems for young people and why it's important that young people are meaningfully engaged in this agenda. Without meaningfully engaging young people in all their diversity, in all their lived experience, in all their unique expertise, we won't be able to achieve effective digital health systems or indeed develop services that will genuinely meet their needs and that of the next generation. And when we talk about engagement, this doesn't just mean engaging young people at the end of the process, as consumers or as beneficiaries, but it's actually about enabling them and empowering them to claim their rights and to participate in every step of digital health design, development, implementation, and evaluation. So right from the beginning through to the end. And there's also a need to recognize some of the distinct ways in which young people are interacting with technology and digital spaces. Why is this important? Well, beyond the traditional boundaries of our health systems, as we kind of see them and understand them, digital transformation is already shaping the health, the rights, and the relationships of young people today. And that's very true whether these are young people who are already digitally connected, or even young people who perhaps are actually not able to access digital spaces in the same way. Their lives and their surroundings are very much influenced by technology. And it does bring great opportunities. So, you know, as young people, we have the opportunity to utilize digital spaces and digital services to access the kind of services that are free from judgment, from stigma or gatekeeping. I think this is particularly important when we talk about issues like mental health or sexual and reproductive health and rights, where young people's health has yet to be fully realized. And we can use technology to learn about our bodies, find peer support, and seek out health advice when we need it. So that all sounds great. But it also comes with very specific challenges for young people that I think are also worth highlighting. So the digital space is really fast-paced, changing rapidly, as all of us know and have seen. And I think the influence of different actors, including potentially commercial actors as well, isn't always clear, and it's not always regulated in the same way. So this really comes back as well to you know, safeguarding the way in which young people are engaging in the digital space, and really looking at some of these frontiers around regulation. Also digital literacy, actually, and I think a few of our other speakers have mentioned this as well. But this means that the digital space, while it has a lot of opportunities, isn't always maybe as safe as young people think. So how we as young people can grow up and realize our rights in the digital space, and also harness the benefits of digital health transformation without fear of exploitation or data being misused is really, really key. I spent a lot of time consulting with other adolescents and young people around their health priorities. And I think a sort of common theme that comes out time and time again is the balance between safeguarding and agency in the digital space, and also the need for solutions that promote access to health services, particularly those that, you know, really are focused on finding new and innovative ways to meet the genuine needs of young people rather than putting additional barriers in place. And indeed on that, you know, not making assumptions about the kind of digital health services that young people actually need and want, but consulting them and hearing their voices on that. The other thing that young people raise time and time again is concerns about how some of the big challenges that we have in many of our communities, you know, discrimination, oppression, and some of those long established inequalities can be amplified and perpetuated in the digital space. And I think there's a lot of concern about how that may influence and interact with digital health approaches as well. So our policy responses need to respond to these concerns, but also to capitalize, I think, on the opportunities that the digital health agenda presents to really reorientate health systems towards rights and equity. And to do that, we need to bring young people in. We need to actively involve them as partners in this agenda, as co-creators who are developing solutions and services, as advocates shaping policy and governance around digital health, but also as the next generation of accountability leaders for more person-centered digital health. And then finally, I just wanted to make a very quick plug here, because to spearhead this approach, my organization, Young Experts Tech for Health, or YET4H as we're known, is bringing together young people and their allies to set out very much a youth-led roadmap towards achieving UHC and health equity through the realization of digital health. And we're working with Transform Health and other partners in this. And this week we launched our Humans of Digital Health series, which features young people's voices and perspectives on digital health from across the world. We hope this is the beginning of an innovative and more intergenerational approach to digital health transformation, and look forward to working together.
Thank you very much, Lucy. I think you bring up that intergenerational aspect in terms of policy making. I would like now to go to François Varny, who's the Director of External Relations and Communications at the Global Fund for AIDS, TB and Malaria. And I know the Global Fund has actually a wealth of experience of engaging very meaningful young people at the country level. So how are international organizations working together on this agenda, especially on the sort of digital and health accelerator of the SDG Global Action Plan?
Thank you. Good morning, good afternoon, good evening, everyone. It's actually a great pleasure to be here in person. So thank you very much for the invitation. I wanted to start by saying that it's a big realization, not to say a big shock for us working in the area of AIDS, TB and malaria, to realize that actually the world can get real-time data on COVID-19, literally by the day, while sometimes we need to wait for a year or more than a year to have accurate data for HIV, TB and malaria. So we got the HIV data from last year, in the middle of this year. The TB ones last month, and the malaria report is due to be issued next week with the data from last year. So the need for timely information, I mean, we knew that, but COVID-19 is making it so obvious how big a difference it can make. And you referred to time earlier. You know, time, we always say time is money, but in that case, time is lives. And the more timely, accurate, high quality data we get, the more we can make the right decisions when it comes to health interventions. So for us, it's really a key agenda to accelerate and transform the way we approach data, health information systems, and obviously digital health. So this is an urgent and very important agenda for us. And that means that we need to absolutely double down our efforts, including in the SDG 3 action plan, the accelerator number 6, on data and digital health, if we are to realize UHC, because it is at the very heart of accurate, appropriate decision-making processes in the health space. So that to start with. Many speakers have already mentioned it. Fragmentation is not helping us. We need collaboration, and we need alignment. We need collaboration, coordination, and we need to work under the umbrella of national health strategies and national digital health strategies. If we don't do that, then we have no interoperability, we have no alignment, we're just wasting time, efforts, and therefore lives. So we need to reduce fragmentation, work in much more collaboratively, and driven by country digital health strategies. That's really, really important. The other thing that has been mentioned by other speakers is that it's a whole society effort, and we need to engage all the actors, including civil society and communities. We've learned that over the 20 years of experience of the Global Fund, that having communities involved at the very beginning in the design of the solutions is what is going to ensure that the solutions that we put in place are the right ones, are inclusive, are effective, are impactful, and transparent. So engaging civil society, young people, it's been mentioned many, many times, and civil society partners is key. It will help ensure that human rights are sort of built in the approaches we take right from the beginning. And in our world, again, it's a question of life or death in a way, because many of the populations we support and work with are stigmatized, criminalized, and access to information, their health information, can be a route to effective support, but it can also be a route to jail or worse. So having the communities themselves and civil society partners engaged in whatever we do in terms of our digital health interventions is going to be critical to ensure that those are inclusive and are protective of their privacy and safety and security, particularly when it comes to criminalized or stigmatized populations, as we've been experiencing. The other thing perhaps to say, so the Global Fund has been investing a lot in health system strengthening. I know one speaker mentioned the Global Fund as a vertical fund, but we've learned the lessons, and gradually over the past 20 years, we've become a health system strengthening fund. We invest more than 1 billion a year in 120 countries in strengthening health systems. And obviously that includes a large chunk of strengthening health information systems and supporting digital transformation in the countries we support, with around 150 million a year investing in that particular area. Very much also driving catalytic funding to push for innovation and really trying to support that transformative agenda alongside in-country partners. I'll stop there for now. Thank you.
Well, thank you very much, Françoise. And yeah, this I think the Global Fund really has made incredible strides over the years to really have this sort of health system strengthening. And it's one of the first one who actually started to engage on community system strengthening, which still has not really been taken up by many as much as the Global Fund has done. I would like now to head to Isabel Mauro, who is the head of digital communications industry at the World Economic Forum. Isabel, welcome, if she is there. Okay.
Yes.
And I would like to sort of hear from you in terms of the role of the commercial sort of sector in terms of really viable models, and sort of what is the role of industry in terms of innovation support as an enabler of digital solutions for universal health coverage. Over to you, Isabel.
Hi, good morning, everybody. I hope you can see and hear me. Yeah, good.
All well.
Thank you. Yeah, so I want to, before jumping on the commercial, I think one of the things I would like as well to reiterate, I think we heard a lot from the previous speakers on timing, and models. And I think the pandemic has really made it clear that not only that healthcare delivery can be provided digitally, but also that connected care can really bring assistance to the underserved and unserved, population. And I think in terms of timing, the pandemic really marked a turning point in the sense that we saw an acceleration of all these services, and for both industry and government was really a turning point in trying to join efforts. And when we talk about what industry can do to ensure that there is innovation, I think one of our role at the forum, because we are not, the World Economic Forum is also an international organization, but I think we have probably the sort of the most representation of the private sector as well as public sector and civil society. So for us, the key here is really the collaboration, and collaboration is really critical in all fronts. If in particular, if you want to make digital healthcare inclusive, interoperable, and trusted. And I think there are three areas of collaboration. One is really between government agencies, because it's critical that ministers from ICT cooperate with ministers of healthcare, with ministers of finance, and so that we have policies and regulation that are aligned to strike the right balance between protecting the patients whilst we are really fostering innovation and making it inclusive. The second one is really between the public and private sector. And we really need to build trust around safe solutions that include all segments of the population. And we need also to find new ways of finance. And that's something that Françoise, I think, really mentioned, with the fund. But at the forum, for instance, we've been looking at digital bonds, and bonds for digital inclusion, and how we can really include, if you want, when there is an issuance of bonds by corporations, how do you also include inclusion into that element, digital inclusion, not only to fund infrastructure, which is typically the telcos, but also the digital services, which are more from the sort of healthcare providers and other services. And finally, I think when you ask about what industry can do, I come from a very ICT background, from representing the Mobile Association in my previous life. And I think that the typical element here that is going to be critical is really the collaboration between the private sector and the different sectors. So it's really becoming critical that the ICT industry, the telco operators, really work hand in hand with the healthcare industry, with the investors, with the financial sectors, because it's critical that we establish business models that are going to be commercially viable in the long run. And that's what is going to be really important, because in particular in delivery of healthcare over digital, you need to have sustainable and long-lasting products. You can't have just a sudden cancellation of programs or medical programs just because financially they were no longer viable. And so I think all of those, are really elements that are critical. Now, we've created at the forum the Edison Alliance, which is specifically that is bringing the industry together across sector with the public sector and the civil societies, and there the aim really is, the goal is to improve 1 billion lives through affordable and accessible digital solutions by 2025 in 3 core areas, which are education, financial services, and healthcare. And in fact, today we published the shared guiding principles for digital health inclusion, and that is precisely really to explore how we can make corporations as well as government, but particularly corporations and organizations, to explore sustainable, effective public-private partnerships as one of the avenues really to look into the challenges that we are currently facing. And part of this is really to, how you can include 7 of the principles that we have really in helping the partners include them in the design of their digital health products and services as they develop these services. And I know, Françoise, you mentioned that, this is really important that we do that from the onset, when you actually create those products, when you actually design those policies. And those are really, we believe like so solutions, if you want, or at least principles and guidance that can really help escalate and accelerate, hopefully, the services. So it's really looking at, how you can be inclusive in the design by prioritizing equity and access, and, how you can embed these solutions in the design of all the products, of the services, the policies, the regulations, the supervisory practices that we have, security and governance, but also looking at, how we ensure that, for instance, that the health of women and girls is at the forefront, which are often, areas and a population segment of the population that is not prioritized. How do you allow individuals as health citizens to connect their data and integrate their care across physicians, clinics, and hospitals through platforms that really allow providers and patients to access each individual health records with checks and balances in place. So it's really putting, if you want, inclusion, trust, and equity at the core of what the practice is when you launch products. Now, in terms of investment funding as well, I think the estimates show that there is as much as $1.5 trillion that is being invested globally by private equity and venture capital in a massive array of new products and services. And I think as healthcare providers, as the industry, there is a responsibility here to ensure that all individuals can benefit from the mode of keeping people healthy and aiding them when they're sick. So prevention and cure as well.
Thanks a lot. We have to slowly wrap up.
Yeah. So yeah, I'm just, for us, again, collaboration is key. And I think at the forum, I'm inviting everybody, and I'll share all this now on the chat, but it's really an invitation for more collaboration. And we are really offering a platform where we want to see other initiatives helping scaling their initiative up, finding the funds such as the Global Fund, and really coming all together, because we have the critical mass of all sectors of the industry. And we really want this to become a true collaboration.
Thank you very much. And as you say, industry has an absolutely critical role to play. But as we've seen as well, just recently, it's very important that people's lives are put ahead than profits of some of the big tech companies in that space. And I do think that's, again, is an advocacy effort that we collectively need to address. So last but definitely not least, over to Nick Tomlinson. He's the Global Health Advisor at OECD and the UHC 2030 Lead on Digital Health. And OECD has done quite amazing work, actually, for quite a number of years in the digital space. And I might give to you then one of the first audience questions that asks whether there are country examples where sort of AI related sort of policy issues have been integrated into national strategies. And that question then came from Anis Fauda. And so if you could just at the end, we move straight into the Q&A and ask you maybe, Nick, to answer that question related to example related to regulatory framework in AI and health sector. Over to you, Nick.
Thank you, Stefan, and hello, everyone. I should perhaps start with a brief explanation of what UHC 2030 is, for those of you not familiar. UHC 2030 is a global movement that brings together diverse stakeholders in a shared endeavour to strengthen political commitment and promote joined-up action towards UHC. It provides a platform for sharing experience and knowledge and developing guidance and advocacy tools to strengthen the health systems, both for UHC and also health security. Comes with a secretariat provided by WHO, the World Bank, and more recently, the OECD. So far, it's probably fair to say that UHC 2030 hasn't really engaged in digital transformation work. So what I'll discuss today should be seen really more as ideas for future work rather than projects that UHC 2030 is already working on. With that brief caveat, I'll touch briefly on 3 issues. First of all, the opportunities, challenges, and barriers to implementation of digital solutions in healthcare. If we look first of all at some of the opportunities, and I think we've already heard this afternoon how COVID-19 has underlined the importance of making health systems more resilient, both to improve pandemic preparedness, but also to strengthen underlying health systems. And I think it's clear to see that digital technology very much has a key role to play here. And the pandemic has shown the importance, as we heard earlier, about having access to real-time health data for making informed decisions. It's also, I think, if it wasn't for virtual consultations, then certainly in the early days of the pandemic, I think much of the primary healthcare system would have struggled to keep up with demand. But we've also seen other advances, particularly, for example, in the use of artificial intelligence to aid diagnosis and improve management of patients. Looking more specifically at primary care, for example, I think we see that the introduction of electronic health records has a lot of opportunity to improve the quality of care, including reducing medication errors. It can improve patient engagement and at the same time can help reduce costs. And already that we've seen some good examples of technology-enabled primary care services. For example, in Rwanda, there's a system has been introduced linking telemedicine, AI-powered diagnosis, and care records shared between various service providers. And I think one thing that really is clear to me is that in the longer term, digital technologies provide an opportunity to really redesign the way healthcare is provided. And if there's time, we can touch on that in more detail. But then secondly, if we look at some of the challenges, I think some of them go broader than health, for example, internet access. But then if we look more at some of the health specific challenges, I think perhaps the biggest challenge is the lack of data interoperability. Other challenges we've seen include whether data that AI systems are trained on, for example, is representative of the countries where those systems will then be used. And another example we saw more recently was possible genetic bias in digital devices such as pulse oximeters. And finally, if we look at some of the barriers, as I mentioned earlier, for some countries, improving access to the internet remains by far the biggest challenge. But once that has been resolved, I think it's probably fair to say it will open up the way to a range of innovative solutions. A challenge then will be resisting the temptation to simply try and digitize existing ways of providing healthcare. And the real benefits will only come by a complete redesign of health systems. And here the barriers are more institutional and organizational rather than technological. And I would suggest they really require action by government in three main areas. First of all, having an overarching digital strategy that goes beyond health, that cuts across all sections of government, that sets out a consolidated vision, a plan and policy framework. Then secondly, strengthening the governance of health data to enable data and health technologies to be put to productive use, while at the same time ensuring data privacy. And here the OECD has developed a recommendation on health data governance, which I think could be a useful tool for other countries to look at as well. And then finally, there's a need to build institutional and operational capacity, particularly in terms of equipping and preparing the health workforce with the skills needed to work in a digitally enabled environment in the future. So to conclude, I'm fair to say that UHC 2030 is well placed to provide a forum for sharing experience and knowledge between countries that are already well on the way to transforming their health systems, making them more digitally enabled, and those countries that are just beginning the journey, an opportunity there to identify common challenges, ways to address barriers, and reap the benefits collectively of digital transformation of health systems.
Thank you very much, Nick. And I'll go straight now to some of the questions we have from Pigeonhole from the audience and Anis Fuad. And I might actually ask Nick to answer that or anyone else from the panel, that whether there are examples of countries developing the regulatory framework for AI in health sector. Nick, do you want to answer that, or anyone else?
No, I'm happy to take that question. I'm not sure I've got a comprehensive answer to the question, but I think there's two aspects I would cover there. First of all, one thing the OECD did, and wasn't restricted to health, it was across AI as a whole. We developed a set of recommendations on AI, these were picked up, where are we, 2 years ago now, by the G20, that then published them as G20 principles on artificial intelligence. More specifically, I think in the healthcare area, and I'm not sure how advanced their work has got, but I'm certainly aware that countries such as the UK are looking at various mechanisms for regulating artificial intelligence in the health sector, depending very much on the nature of the particular product that's in question, ranging from a light touch regulation at one end to a more detailed assessment at the other.
Yeah, thank you so much. The next question is an anonymous one, but has a lot of votes, and I would like probably to ask Henry for that. In your vision, how could digital health contribute to increased access to rehabilitation services globally, specifically around rehabilitation? I don't know whether you have in East Africa some examples, or anyone else from the panel who has specific understanding on the digital health space in the rehabilitation services.
Thank you, Stefan. Personally, I haven't seen any examples where digital health has been really utilized when it comes to rehabilitation, but it's an area where I think when you look at health sector in a holistic manner, those should not be forgotten as well. But personally, I haven't come across any.
Yeah. Okay. Anyone else on the panel? Otherwise, the next question, we are a bit pressed on time. One question maybe to François from the Global Fund. In terms of the introduction of digital health tools and the challenge of equipping then health workers with basic ICT skills, now, how is the Global Fund, for example, tackling through its health system strengthening on the digital space, the capacity, digital literacy of health workers?
Thank you. Thank you for the question. So as part of our investment to support countries to strengthen their health systems, including data and information management, we do provide support for the systems themselves according to what the countries have chosen. Of course, we do not impose anything in that space. And we provide also technical assistance. So that would cover some of the issues mentioned in the question in terms of making sure that health workers, including community frontline health workers, have the basic tools to be able to use digital technology on the ground. And that's really important because one of the challenges we've figured out is that actually most of the facilities do have access to digital technology, but the quality of data that they gather is not good enough to inform decision making. So in that sense, training and technical assistance is really, really important to make sure that the data are accurate and of good quality.
Thank you. I think I have to leave it there, but what I will see with the organizers and Transform Health that we capture some of these other questions. There's about 4 more questions that got much lower votes. And then Transform Health might, get that sort of posted that you can have a look at the Transform Health site or a relevant site that you will figure out as the organizers. And I invite now Matilda Forstlund, who is the Executive Director of Transform Health, to give us a short overview of some of the very key issues they're working on at the moment. Over to you, Matilda.
Yeah, thank you so much. Can you all hear me? I think so. So it's really a big moment for us today because 2 years ago, we kicked off Transform Health, and we could really not foresee, the situation that we are in today with this global pandemic. And we envisioned 2021 to really be the year that we kicked off officially our campaign to take forward the recommendation of the Lancet and FT Commission report that came out at the World Health Summit this year, and also to launch our efforts in our priority countries, which are Indonesia and Kenya. So we had really envisioned a big global launch at the UNGA in 2021, but then COVID hit and we had to pivot. So what do? We launched Digital Health Week, which I think many of you have been part of this week. Which is a global week of action where stakeholders come together to champion health for all in the digital age. And it's really been an amazing uptake. We've had more than 50 events being organized and will be organized throughout the week in 35 countries in these 5 days of this week. So we're really, really excited and overwhelmed with the commitments and action that has been taken to spark political action for UHC. So we can go to the next slide, please. So for those of you that don't know Transform Health, we're a global coalition of 26 organizations and growing, committed to achieving universal health coverage through the use of digital technology and data. Next slide, please. Our mission is to build a global movement that brings together different organizations and institutions across sectors who are committed to achieving universal health coverage in the next 10 years, or it's really 8 years left now, by expanding the use of digital technology and increasing access to data that are in line with our core principles that you can see here, which is equity, empowerment, rights, inclusion, and partnerships. Next slide, please. So we have three objectives, and the first one is that we want to create stronger political will and decision-making processes to push for digital transformation of health. The second objective is that we want a human rights and equity-based health data governance framework, and we've been speaking a lot about that today. And then the third objective is to increase investments and coordinated funding for digital health. Next slide, please. So Transform Health is operated as a franchise model of influence and change through country campaigns, regional campaigns, subnational campaigns, and global campaigns. And we work with organizations all around the world that are already doing great work on the ground, nationally and regionally, and who are already, speaking to specific audiences or working on specific technical areas. So we try to support them to establish Transform Health coalitions nationally in their context, and also to work towards our common and agreed goals. So we do not lead, we try to enable. And we enable and collaborate and lead engagement at national and regional level, and really leverage and grow experience and expertise that is already existing to reinforce some of the work that they are doing nationally, also at the global level. Next slide, please. So I'm now going to talk to our 6 calls to action that also came out of the reports, and the card that you all have on your seats today is at the back of that. You can actually scan the QR code and you can get direct access to the report that way. So we have 6 calls to action, and this is really the actions that we are going to take forward as Transform Health over the next 8 years. So the first one is to put communities at the center of digital health. And so Transform Health will be working with partners to ensure that marginalized and hard to reach communities are included in national planning and implementation of digital health strategies. Next slide, please. The second call to action is to design and implement digital health strategies that will deliver UHC. So Transform Health is engaging and will continue to engage with governments in our priority countries, and our priority countries are Indonesia, Kenya, India, Ecuador, Senegal, and Mexico, to ensure digital health solutions are being developed and implemented to achieve UHC. Next slide, please. Our third call to action is to support health workforces to enable digital transformation. And so what we call for is that frontline health staff, including community health workers, have access to adequately equipped, supported, and remunerated for their work and in achieving UHC. And so what we are doing as Transform Health is really working with our partners to canvass the views of health workers to ensure digital health solutions are implemented in a way that support frontline health workers. Next slide, please. So our fourth call to action is to ensure stronger regulation and legislation to create an enabling environment for digital transformation while protecting rights and privacy. And so here we are calling for governments to update regulation, legislation, and standards to enable digital health providers to operate in a much more effective and efficient manner in support of UHC. And so Transform Health is carrying out landscape analysis with our national campaign partners and coalition platforms to influence decision makers to ensure an enabling environment for digital transformation of health systems. Next slide. So our fifth call to action, almost there, is to increase domestic and international investments to strengthen digitally enabled PHC systems and empower communities. So here we call for national governments and international donors to increase their investment in equitable, digitally enabled PHC. And Transform Health in partnership with the Job Lang Institute, so Christoph Ben, Path, Digital Square, and others, lots of our donors that are sitting on our resource and investment circle, is conducting an assessment of the funding environment to better understand the funding modalities and how they are contributing to digital transformation of health systems. And these recommendations will feed into our donor engagement work moving forward in the years to come. And then the final call to action is to create a global governance framework for health data to maximize the public benefit of data while safeguarding individual privacy, ownership, and security. So what we are doing here is really pressing governments and multinational institutions to develop a global health data governance framework that is supported by a set of principles based on equity, inclusion, and human rights that we're actually launching in the next few months in 2022. And we have a really great data policy circle, which includes FIND, Rigveda, as you are here in the audience, and others, Path, and others that are really working with us on pushing this agenda forward. So with all that said, I think the final slide is just to say thank you to the team. A special thanks to our coalition partners, our board, our funders, and really our really dedicated team of the enabling function, which is our secretariat. And I especially want to thank Frank and Kirsten, Asmita, who's online, and Louise, who's written the report. Who has really made this first Digital Health Week such a success in this week of action. Thank you.
Thank you so much. And my Swiss time management is not so good as we are almost running out of time, but we have as well just somebody making some closing remarks. Bill Rodriguez, the CEO of FIND, who I understand, I'm not sure, is not in here in person, he is online. And let's just have him some closing remarks. And then we have Dr. Reinhard Scholl, the Deputy Director from the ITU, who open us up, then do close us again. Over to you, Bill.
Hi, thanks, Stefan. I hope you can hear me.
Yeah.
Thanks for the opportunity to close. So I'm Bill Rodriguez. I'm the CEO at FIND. We're the Global Alliance for Diagnostics, and our mission is to ensure equitable access to reliable testing and diagnostics around the world. I appreciate the opportunity to try and close the meeting. It's a daunting task. As all of you heard today, there were so many essential points made about how can we harness the potential of digital technologies and digital tools to make sure we drive health equity and not health inequity. You can imagine even in the narrow area of diagnostic testing for us at FIND, digital health is critical to our work. Rigveda Kedam is there with you in the room, and she's the head of our digital health program, which we've had for several years. A medical test is useless if the information it provides is lost, or if you need to interpret the test, or you need a clinical pathway and there's no local expertise available, or the result needs to be acted on and the linkages can't be made appropriately. And testing is also critical not just to patient care, but to public health and public health interventions. We all know this acutely from how our lives have been affected over the past 18 months. And I'm sure we've all engaged digitally with the pandemic, but the digital divide has been a major barrier to pandemic response in low and middle income countries at all levels since it began. I'm currently in Botswana. If you've been watching the events unfold around the emergence of the Omicron variant this week, you'll know that that the detection of Omicron was a result of the integration of good diagnostic testing and digital tools for rapid surveillance, analysis, and dissemination. And yet those digital health interventions can be used to drive good policy or bad policy. I think we've seen several examples of both this week. So let me just take 1 minute, Stefan, and hand it back to you just to reflect on a few points I heard during this session. I think both Francoise and Isabel made the point that COVID has demonstrated how much faster we can move, and the pandemic is really a turning point for industry and for governance at the national, international level to move faster through collaboration across sectors and through the principle of inclusiveness. So let's not wait, right? Let's take advantage of that and move. I heard Nanjira say something which reminded me of a quote from William Gibson, which is, he said this 20 years ago, which is that the future is already here, it's just not evenly distributed. And Nanjira made this point very clearly in her comments that digital tools and data for health that are here, they're being used, but we have a major equity gap. And we need to address that at all levels to support universal health coverage at the individual level, the community level, the national level, and the ethical level especially. And then Njide made the point that even in Nigeria, which is among the world's leaders in adopting digital tools and new business models based on digital technology, we haven't seen enough progress in digital health. And she made this great remark about Maslow's hierarchy of connectivity, which I think is a phrase that'll stick with me. You know, we need the basics. We need the basic needs to be developed and to build on that. And until we can address the equity and digital divide, we won't be able to take advantage of digital technologies for healthcare. I think that was a great point. And then finally, Javier really made a great point that we have to make sure that this is about the patient and that this is inclusive and has to be an enabler of better health focused on the patient, him or herself, and remember the human element of that encounter with the patient. So I think to sum that up, if there's a single health technology in the world that should confront and embrace equity as a principle and as its own cause, it's digital health. I'm not suggesting the issues are easier around privacy or cost or IP or business models, but equity is so fundamental to the potential of the digital world that if leaders in digital health can't embrace that and use their voice to demand equity, then who will? And then Stefan, you mentioned that for those of us who are over 40, and I'm in that group, we're from the analog world. But it's up to the younger generation, the youth, to take this on and transform the world. So Lucy, I would just put the challenge back to you. You mentioned that we need to bring young people in at every level, the developers, policymakers, and political leaders, and I couldn't agree more. I would put the challenge right back to you. There's a quote from Shirley Chisholm, who was a major leader in the US Civil Rights Movement. And this reminds me of the US Civil Rights Movement in a lot of ways. And she said, if they don't give you a seat at the table, then bring a folding chair. So
Fantastic.
That's why I think today's meeting and the report that Transform Health has released is really critical to drive us forward and as a major step on the road to a common agenda. So I'll just end by saying, I guess, happy second birthday to Transform Health, and to thank the Transform team for organizing Digital Health Week and for launching this report, and for everyone who helped put this conference together, Foundation Botnar, CSEM, UHC 2030, Medicus Mundi, Switzerland, AI for Good. I hope there'll be a follow-up meeting to reflect on progress against the agenda that was laid out in this report. And good luck with your deliberations and your engagement there in person, and I'll hope to join you next time. Thank you.
Fantastic, Bill. Thank you. And the message is clear. Let's get all folding chairs and be at the table. And now, Reinhard, just to close us off on that AI for Good ITU session of part of the Digital Health Week.
Thank you very much. Before you disconnect or leave, if you can take 3 seconds to fill out the satisfaction survey that my colleagues are going to put up. It's our Net Promoter Score. Yes, if you pick one of the boxes. So. And then I would like to thank you, Mathilde from Transform Health. Thank you very much, Stefan, Fondation Botnar, and your partners, also our co-convener Switzerland, for making this possible today. Also my many colleagues and other colleagues that were working backstage and were able to put this together flawlessly. Thank you very much. Our AI for Good program is featuring pretty much daily programming, and we actually continue in 90 minutes with a show called robots saving lives in disaster hit areas. So Guillaume, you have to rush back to your workplace. Okay, so with that, thank you very much, and bye-bye.
Selector, rewind selector, rewind selector. Rewind selector, rewind selector, rewind selector. Selector, rewind selector, rewind selector. Rewind selector, rewind selector.